Hello guys, I am Dr. Parvez Ahmed Rishi. I am MBBS MS ENT. Today's topic is about adenoid cystic parotid carcinoma, and this topic is about this is the most important one of the most important topics which is asked in Australian Medical Board. As if you are going to prepare for Australian Medical Board, don't forget to go through this topic, and at the end of the topic I will discuss a question which is given in this book, which is a very important book, and I will also give some summary of this book. So this I took a question from this book, and then I put the topic. I explained the topic. At the end of the topic I am explaining the question also. So let us get started. Now you can have a look at these images. This is the histology. This is the histology of the adenocystic carcinoma, and then you can have on the this side, this side you can have a high resolution CT image of CT image of the parotid adenoid cystic carcinoma. As you can see, there are no margins, there are ill-defined borders are there. So, and you can see there is a calcification, there is a calcification. In this diagram, we are showing a schematic diagram, as these diagrams have been downloaded from Google. And we have, this is the fascial nerve. We have shown the proximity of the parotid gland to the fascial nerve, branches of the fascial nerve, and as it passes between the superficial and the deep lobes. And if these are there, this tumor is a infiltrative tumor, and it has neural invasion kind of property. It invades the nerves, and you can see this gentleman, it has got left side palsy. You can see left side palsy he has developed. Then you can see this lady, she has developed a very huge mass of adenoid cystic carcinoma of parotid gland. Now then let's move ahead. A rare, what is adenoid cystic carcinoma? It is a rare, slow growing but potentially aggressive malignant tumor that can cause facial nerve paralysis and other symptoms. It is characterized by perineural invasion. As we are saying, perineural invasion, it is the most important key. It is malignant tumor, it has perineural invasion, and as it has perineural invasion, we may expect a nerve weakness and a tendency for local recurrence and distant metastasis. ACC is a relatively uncommon type of cancer, accounting for 10% of salivary gland malignancies. It accounts for 10%. It is rare, but it is aggressive. ACC is known for the slow growth, but it can be aggressive and potentially lead to recurrence and metastasis. It may recur, it may cause metastasis, and it may be also slow growing. A key characteristic of ACC is tendency to invade nerves, perineural invasion, which can lead to nerve damage and symptoms like facial nerve paralysis. So, if there is in the question there is sign towards the facial nerve paralysis, go with ACC, adenoid cystic carcinoma. Local recurrence and metastasis. ACC has tendency to local recurrence, the cancer coming back in the same area, and distance metastasis spreading to other parts of the body like liver, etc. Symptoms can include a slow growing mass, pain in the same parotid tumor, facial nerve paralysis is also there. And diagnosis typically involves a biopsy and imaging studies to assess the extent of the tumor. Surgery is primarily treatment for ACC, and in some cases radiation therapy may be used as an adjuvant treatment for more advanced cases. Prognosis is with ACC is slow growing, its tendency for local recurrence and metastasis can lead to a poor prognosis, especially in advanced stages. As it grows slowly, so there is delay in the treatment, and it may lead to advanced stages. Important considerations are early diagnosis. Early diagnosis is crucial for better outcome and quality of life. Multidisciplinary approach is needed, that we have to send the patient for FNAC, and pathologist is needed. Recurrent monitoring, we may have to do the DEXA scanning, recurrent ENT examinations, other things, ultrasonographic. So the radiology department, surgical department, ENT surgical department is needed. So it is a multidisciplinary approach and recurrent monitoring. Now let us have a question. A 63-year-old patient with a history of swelling in front of the left ear, getting larger and larger slowly over past 4 months, limited mobility, left angle of mouth moves less than the right, giving an asymmetric wry mouth when the patient is asked to grin. Eye closure is normal. Likely diagnosis is Warthin's tumor. Why it cannot be Warthin's tumor? Because Warthin's tumor is benign and it won't have this perineural invasion. Pleomorphic adenoma, it is also benign tumor, but it is not having, we don't have we don't have facial nerve palsy in pleomorphic adenoma at the beginning. And adenoid, we may have parotid of the superficial lobe or the deep lobe, but both these pleomorphic adenomas, they don't have perineural invasion and facial nerve palsy. Adenoid cystic carcinoma is the correct diagnosis, and we may have to do surgery, and radiotherapy is the true best modality of treatment. Thanks a lot. Please like and subscribe, and so that we can have good and better videos in the future. Thanks a lot.